Rosacea is a chronic inflammatory skin condition that primarily affects the facial area. It is usually characterized by persistent redness, visible blood vessels, and sometimes acne-like pimples. While rosacea is more common in adults with fair skin, it can occur in any skin type and at any age. The symptoms of rosacea typically present as persistent redness in the facial area, often accompanied by burning and itching sensations. Small, visible blood vessels may also become prominent in this area. Although this condition mainly affects the face, in rare cases, other parts of the body may also be impacted. Rosacea often progresses gradually, and if left untreated, it can lead to more serious problems, such as skin thickening or even eye issues. Therefore, recognizing the early symptoms and consulting a dermatologist for timely diagnosis and treatment is crucial. Different types of rosacea. Rosacea is divided into 4 main types, each with distinct characteristics and symptoms. These 4 types include: 1. Erythematotelangiectatic rosacea. This type causes persistent redness of the face along with visible blood vessels. It often appears suddenly and may gradually disappear. The symptoms of this type tend to be chronic and may recur after a period of remission. 2. Papulopustular rosacea. This type of rosacea is characterized by pus-filled or fluid-filled pimples. The skin may become swollen and inflamed, and its symptoms closely resemble acne. It typically occurs in middle age and can cause significant discomfort. 3. Phymatous rosacea. Symptoms of this type include thickening and roughness of the skin, especially around the nose, which may become bulbous, rhinophyma. This can significantly alter the appearance of the nose, leading to both aesthetic and psychological concerns. 4. Ocular rosacea. This type affects the eyes, causing irritation, redness, and watering. People with ocular rosacea are often sensitive to light and may develop painful bumps on their eyelids. Eye problems from rosacea may require specialized medical care. Who is at risk for rosacea? Anyone can develop rosacea, but some individuals are at higher risk. It is more commonly seen in people with fair skin, and women and newborn girls are particularly susceptible. Symptoms usually appear after the age of 30, although it can occur at any age. People with a family history of rosacea are at greater risk of developing the condition. If a family member has rosacea, your chances of developing it are higher. Additionally, environmental factors and daily stress can play a role in triggering and intensifying rosacea symptoms. Although rosacea is more prevalent in adults, it can also affect children and teenagers, though these cases are rare. Recognizing risk factors and taking care of the skin are essential steps in preventing and managing rosacea. Areas affected by rosacea. Rosacea can impact several areas of the body, primarily appearing as redness and inflammation in facial regions such as the nose, chin, cheeks, and forehead. It may also affect the eyes, neck, chest, ears, and even the scalp. Each affected area may exhibit varying severity, depending on the type and extent of rosacea. Identifying the affected areas helps in better diagnosis and management of the condition. Triggers and potential causes of rosacea. Although the exact cause of rosacea remains unclear, various factors can exacerbate its symptoms. Overexposure to sunlight, extreme cold or heat, stress, alcohol consumption, spicy foods, and the use of inappropriate skin and hair products are among these triggers. Hormonal changes can also play a significant role in the onset and severity of rosacea symptoms. Identifying and avoiding these factors can help reduce and control rosacea symptoms.
Diagnosis process. Diagnosing rosacea requires careful examination by a doctor since there is no specific test for the condition. The doctor will assess the clinical signs and symptoms and review the patient's medical history to make a final diagnosis. In this process, the patient's detailed information regarding symptoms like redness, skin bumps, burning, and dryness is critical. Accurate and timely diagnosis leads to more effective treatments and better management of the disease. Treatment options and managing rosacea symptoms. Various treatments are available to manage and reduce the symptoms of rosacea, although none can completely cure the disease. Common treatments include oral and topical medications to reduce redness, bumps, and inflammation. In addition to medications, laser treatment may be recommended to reduce visible blood vessels and control skin redness. In severe cases, surgery may be required to correct nasal deformities caused by rhinophyma. Foods and dietary factors that may trigger rosacea. Certain foods can exacerbate rosacea symptoms, although these vary from person to person. For example, spicy foods like jalapenos may worsen symptoms. However, individuals with rosacea may react differently to various foods. Identifying and avoiding foods that trigger flare-ups can help in better managing the condition. Cosmetic solutions for covering rosacea symptoms. For those looking to cover rosacea symptoms, using suitable cosmetic products can be effective. Makeup products with a green base can help reduce and conceal facial redness. Additionally, using oil-free concealers a shade lighter than your natural skin tone can enhance appearance. Choosing products suitable for sensitive skin and applying sunscreen are crucial steps in preventing further skin irritation and managing rosacea symptoms. The difference between rosacea and lupus. Distinctions. Rosacea and lupus are both skin conditions that cause facial redness and swelling, but there are important differences between the two. Lupus rashes often appear as red, scaly, and itchy patches, whereas rosacea typically causes redness, swelling, and skin bumps. Unlike rosacea, which is a harmless condition, lupus can lead to permanent skin damage and hair loss. Understanding these differences is essential for proper diagnosis and treatment of each condition. Conclusion. Rosacea is a chronic inflammatory skin condition that can affect various parts of the body, particularly the face. It presents with a range of symptoms such as redness, skin bumps, and visible blood vessels. Numerous factors like sun exposure, stress, and spicy foods can exacerbate the symptoms. Various treatments, including topical medications, laser therapies, and lifestyle changes, can help manage the symptoms. Timely diagnosis and management are crucial in improving the quality of life for individuals with rosacea.